Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Jesse Mahoney, pediatrician and coach. Today's Kevin MD article is Imposter Syndrome is Not a Personal Failing. Jesse, welcome back to the show.
Thank you for having me.
All right. What's this latest article about?
So this article is about imposter syndrome, but I wanted to take a bit of a different tack because I work with so many physicians on imposter syndrome. And especially in women in medicine, we attributed it as a personal problem, something we have to work on. We need to be more confident. And I have come to see it actually more as a systemic issue. And this came to light a couple of years ago. I was doing a team workshop, which was co-ed. And there was a gentleman there who had been in practice for 35 years. And as we were talking about different thought patterns that we have as physicians and the most painful things that we're doing that are causing us to be depleted and drained in our practice, he said imposter syndrome. And I about fell out of my chair. And really interestingly, there was another woman physician there who was about 3 months into practice, and that had been hers. And they were like directly across from each other. And I thought, this isn't a new in practice thing. It isn't, doesn't matter how long you've been in practice. We actually all feel imposter syndrome. And so this got me really thinking about the way that it is conditioned and how it works for the system. And if we think that we might be an imposter, we don't question. We work really hard. We do more and more. We're afraid of being called out or being shamed. And so we just hide and keep at it and keep at it until we burn out and fizzle. And then somehow culturally, it's become a thing that if you have imposter syndrome, that's something you personally need to work on. So I think it's worth bringing up this idea that it's really beneficial to the system. And that while I think it originally comes from a good place, which is pay close attention, and that, working hard is a sign of excellence, it has come to this place that without hypervigilance, you don't care. And it's just escalated and escalated.
Now, for those who aren't familiar with what exactly imposter syndrome is, what does that term mean to you?
Well, so to me, it means feeling like you're an imposter, feeling like you don't belong, feeling like you don't know enough, that somehow you got to the end of your training or you're practicing. I'm a pediatrician, that I don't belong with all the other pediatricians. They know more. And so it's really a sense of not belonging. And I often remind people that we were also trained to notice how we don't belong, right? If you go back to residency or medical school, you would be in a group and your job was to figure out how you didn't belong and figure out how you could morph yourself to belong. And it becomes something where we're just convinced we don't belong. So maybe we don't belong on a stage, or maybe we don't belong in academics, but we also tend to feel like we don't belong with our colleagues or in our cohort, and always noticing that piece so that we don't feel confident.
Now, why does that feeling of not belonging, feeling like an imposter, you said that it benefits healthcare systems or healthcare systems want us to feel that way. Why is that?
Well, so if we feel like we don't belong or we're not enough, is the other phrase that people tend to feel, we work harder and harder to
Mhm.
prove that we belong. And so we tend to then overfunction and overwork and never say no. And we also tend to be hyper vigilant in terms of checking things 3 and 4 and 5 times. In the end, when we burn out, the healthcare systems actually don't benefit. And I would say that the imposter syndrome for many people actually leads to less high quality care
Hmm.
because we're constantly second guessing and maybe not making decisions. And then we are making whatever decisions we are making from a place of depletion. So it doesn't in the long run help them, but in the short term, it helps them because you have people just working like Energizer bunnies, trying to make sure they belong and fit in and keep up, and nobody notices that they are inadequate in some way.
And you alluded to earlier that women physicians tend to feel imposter syndrome more than men. Am I hearing that correctly?
In my experience, that's true. I actually wonder if it's just more acceptable for us to say it.
Hmm.
And this gentleman who had been in practice for 35 years made me think that men may also be feeling it and working from that same space, but it's not really acceptable for men to share that they feel like imposters. In women, it's something that's talked about all the time, but it's a personal failing. And what I'll say is that when in medicine, I think when we feel confident or we think that we believe that we know something, it's often seen as arrogance. And so it's actually considered excellence if you question it and you doubt yourself and you double, triple check and you're doing all of that, which so for women to show up knowing,
Mm.
trusting, and confident is very often perceived as arrogance, so we don't do it. And so it then builds this sense of imposter syndrome because we're always second guessing.
Now, you talk in your article about reframing that self-doubt, not as being an imposter, but a sign of learning and growth, right? So,
Yeah.
how can physicians reframe that in their daily work?
Well, I think this idea in medicine, we actually shouldn't know all, right? It's
Yeah.
better to not know. And we frame uncertainty as dangerous. But if we could actually frame this uncertainty or not knowing as an opportunity to learn and grow, be better doctors, learn about our patients, really the scientific method is to question things and to be uncertain and to figure out new ways. But in medicine, we kind of cut that off and say that it's not okay to not know. We're trained that if you don't know, you should go home and study until you do know and you know all the answers. And I think it actually gets us into a bit of trouble. And so if we can begin to recognize that not knowing is actually not a problem, and if we can, in our medical culture, say not knowing, honoring that you don't know and asking questions, it's actually going to help us all provide better care and continue to learn. Most of us want to learn and know. And in fact, if you knew everything, then you would not evolve. And we all pretty much believe in evolution and ongoing lifelong learning.
And I think that fits into the larger theme of suppressing vulnerability and how the medical system and how healthcare system really stamps out all signs of vulnerability and discourages all of us to show that vulnerability, right?
Right. And because I think the systems thrive on our vulnerability, right? Because then we all continue to work as hard as we can. And the system benefits from that in the short term, not in the long term, but in the
Mhm.
short term.
So, what are some ways that medical institutions should change their culture to stop normalizing imposter syndrome?
So, one would be bringing in more of a culture of self-compassion and kindness. And self-compassion is so hard for doctors, but it's really this idea that we are human. And so, self-compassion is common humanity and it's mindfulness, so just awareness. And it's kindness. And so, this idea that self compassion, we think of it as a pass. So, if something goes wrong, we immediately in medicine go to blame, shame, or guilt.
Uh-huh.
And instead, if we could show up with self compassion, which would say, I did the best I could in the moment with the information and education that I have, and ask different questions. So, what can I learn from this? How can we grow from this? I like to think I don't like to think, but our peer review and our M&Ms are really shame based.
Yeah.
And so, if we could make them more learning based in this idea of lifelong learning without the blame, shame, and guilt, that would keep us out of imposter syndrome. And I think this idea and acceptance that we're all learning and there isn't perfect, there isn't that right or wrong dichotomy, that in fact, learning from each other and continuing to
Mhm.
learn and grow could be the definition of a good doctor. And asking questions should be the definition of a good doctor, as opposed to, I think even in a lot of training environments, we think that asking questions means they don't know. Residents and trainees are often criticized for asking too many questions when they should just know it. And so if we could just change we talked about this before, the judgment, the immediate judgment of it, and instead show up with more curiosity, we would ultimately be able to shift out of it and make room for this compassion. We know physiologically it helps us learn and grow. So imposter syndrome doesn't help us learn. We fill ourselves with cortisol, our amygdala shut down, and then we're not doing what we ultimately want to do in medicine, which is evolve and learn how to provide better care over time.
And have you seen from your experience healthcare systems that evolve to that vision that we just described?
Not yet. I work with a lot of physicians who work in peer review, though, partly because I think being a physician who leads peer review is actually a pretty painful position. So they tend to come to coaching a lot.
Sure.
And I think when people begin to understand the way that shame, blame, and guilt get in the way of learning, it does begin to shift. I think that it's going to be slow because in our culture, and this has been a culture in medicine for a long time, self-compassion is a pass.
Hmm.
But there's a lot of new science about how it's, I like to think of it as a life raft for challenging times. And these are challenging times in medicine. And there's a lot of energy around this idea of self-compassion. And there are quite a few healthcare organizations who have adopted programs to teach more self-compassion. And so I think it will slowly begin to be there.
Sure.
But if we continue to label imposter syndrome or fear of making mistakes as something wrong with you, we're not going to get there.
Now, for those physicians who struggle with those feelings of imposter syndrome, what are some first steps that they should take?
I would say recognize it's not a personal failing. I think for many, when you begin to see that you were trained to notice all of your deficiencies and you were taught that actually to doubt yourself is a measure of a good doctor, then it's not a personal problem. And
Sure.
so then you can begin to say, well, this was helpful when I was a resident, but I don't necessarily need to keep moving it forward. Another way I've found to be really helpful is to not focus on being confident, because for many of us, that's pretty far a stretch, but to
Mhm.
focus on another way of maybe calm and grounded, or how can you trust yourself? How have you made good decisions in the past? So, beginning to ask yourself different questions can really change your relationship with it. I see so many people who are kind of bashing their head against it because it's
Mhm.
a problem and it's a problem that needs to be fixed instead of perhaps changing your relationship with yourself and your approach to learning and your approach to judgment.
We're talking to Jesse Mahoney, pediatrician and coach. Today's Kevin MD article is Imposter Syndrome is Not a Personal Failing. Jesse, let's have some take home messages they want to leave with the Kevin MD audience.
I think that everyone in medicine has some degree of imposter syndrome, and it doesn't mean there's something wrong with you. If you doubt yourself, it's not a personal failing. It's a way that you were trained to think. And so if you can begin to reframe self-doubt as learning and growing and wanting to learn rather than a deficiency or an inadequacy, that is actually how you will become the best doctor, and you'll also retain enough energy to continue practicing.
Jesse, as always, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thanks for having me. Appreciate it.